Hello, everyone. Welcome to Lump Basics, or TCM, and Acupuncture 101. We now continue with discussion of the following topics. For today, for the first presentation, let's start with energy flow between Luo and Yuan points. Now, question, is it possible that coupled organs do not have the same picture of imbalance? Could it be that stomach has excessive yang and the spleen is cold? The coupled organs, they have internal meridians through which energy flows to and fro. Since in the interior the climate is similar, we say that as long as energy flows from one to the other organ, they will have a similar picture of imbalance. But it is possible that because of internal blocks or surgical scars, that the energy flow in the interior is obstructed. If so, it is possible that coupled organs have different pictures of imbalance. It is therefore necessary to tonify or sedate them individually. So another question, many books say that energy flows from the Luo point to the Yuan point. So actually, this requires a very difficult. This is a little bit difficult because there are books that do not agree with some teachings. No, so which way does the energy flow? Western textbooks on acupuncture seem compelled to specify the direction of energy flow between the coupled channels. However, none of the classical Chinese texts specify the direction of energy flow, nor do they state whether energy flows from Yuan to the Luo point or vice versa. Chinese medicine is derived from practice and empirical knowledge rather than based on logical deductions. It is stated in the classics that a Luo connecting point connects the two coupled meridians, but not exactly the why and how of it. If coupled organs are diseased, it is customary to use the Yuan source point of the first diseased organ and the Luo connecting point of the second affected one. The simple name source point suggests the energy flows out of this point and into the connecting one. So we should look at how the Luo connecting points are used in symptomatic prescriptions. Example, point stomach 40 for excess mucus or edema, reduces mucus, decreases yin. Point gallbladder 37 for bright sight, improves function, increases yang. These are not generally used in combination with Yuan source point of the coupled organ. These increase the yang of the yang organ, so there must be points where the energy enters. Example, pericardium 6 is a universal calming point and is used also against vomiting and tachycardia. Lung 7 is not only used for the lung, but as the confluent point of Ren channel to influence the yin of the whole body. These 2 points make the person very yin. Again, the Yuan source points of the coupled organs are not used, as the use of PC6 and lung 7 makes the person more yin. They must be points of entry. Energy flows from Yuan to Luo, and in most cases, it is sufficient to use only the Luo connecting point of the deficient organ. That is, if the yin aspect is weak, use the Luo point of yin organ. If the yang energy is weak, use the Luo point of the yang organ. So Yuan source points of yang organs and the Luo connect points of yin organs. So spleen is the only meridian that has 2 Luo collaterals and 2 Luo connecting points. So we sedate Li4, okay, to affect the lung 7. We sedate the triple warmer 4 to affect lung 6, pericardium 6. We sedate Si4 to affect the heart 5. We sedate bladder 64 to affect kidney 4, We sedate stomach 42 to affect the spleen 4 or 21. We sedate gallbladder 40 to affect liver 5, and no Yuan points on Du channel, RAN 15. So this imbalance could be in a yin or its coupled yang organ, and the same combination of points can be used. Both spleen 4 and 21 are used in situations where the yin is deficient and the yang high in either the spleen or the stomach. If the symptoms are in the periphery, for example, dry inflamed lips, spleen 4 is used. If the symptoms are in the interior, as in chronic gastritis, then spleen 21 is used as it is located closer to the stomach. Example, kidney yin excess and yang deficiency. Symptoms, generalized edema with little urination. This shows weakness of kidney function, as it is an organ that eliminates fluid. According to their interior relationship, coupled organs have the same picture of imbalance. So treatment, sedate kidney 3. We sedate kidney yin directly and urinary bladder yin indirectly. Tonify bladder 58. Tonifies urinary bladder yang directly and kidney yang indirectly. Okay, so that we arrive at this new balanced state for both organs. Thank you very much for listening. We now listen to the next presentation. Let's welcome Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector, at sa lahat na po. Now let's continue our studies on local and adjacent points. Dito na po tayo. Clinical example 1. An obese woman had osteoarthritis of knee. The stiffness and pain was in the spleen and liver channels and worsened when she started to move after a rest and improved gradually over 2 to 3 hours of movement. This showed there was some fluid dampness in the affected area, which required a longer time of movement to circulate before the stiffness disappeared. Some of local points in the affected area are kidney 10 and liver 8. These tonify the yin in both channels. When these points are used as local points, they will still function as tonification points, thus making the pain worse. Therefore, these points must be avoided as local points. Take note of this. And random points should be selected instead. However, point spleen 9 is also in the vicinity of the pain area, and this is generally used against fluid retention and would double very well as a local and symptomatic point. Okay? Now let's go to clinical example number 2. In acute tennis elbow, there is pain during movement, lifting weight during pronation and supination. The site of pain is very near point LI11, which is the tonification point. This is a yang dominant pain and an acute situation. Therefore, it is manifestation of yang excess of the knee region. If LI11 is needled as a local point, it would tonify the knee region and the pain would worsen. This point could be avoided during treatment and other random points chosen. Okay? Next, another clinical example. A patient who is well into her 25th week of pregnancy comes to you with backache. Her pain is in the lower back, and you treat her with several back shoe points and are local to this area. This is very common practice. However, many points along a single meridian could increase the energy in the meridian. In this case, the yang of the urinary bladder meridian. The urinary bladder meridian is directly linked to the uterus and to its contractions. It is possible that your treatment for backache could start off early contractions. Therefore, it is better to avoid the urinary bladder meridian points and to use random points as local points for backache. Okay? Now let's go to area distal points. These are points that treat an entire area. They have been found to be effective in influencing and harmonizing any disease or symptom, either external or internal, in the 6 areas shown in Table 5.1. They are not used especially for tonifying or sedating. It should also be noted that these points do not cover the area of arms and legs, but only the head and the trunk. If you need to influence the arms, legs, or the internal organs, you should use the meridian distal points. So we have here a table of acupuncture point and region of influence. LI4, region of influence is the head and face. It is indicated for all headaches, facial pain, diseases of sensory organs. Lung 7, region of influence is the neck and occiput. So its indication is occipital headache, neck pain, thyroid, and frog and throat. Next is pericardium 6. Region of influence is thorax and upper abdomen and is indicated for cough, asthma, chest pain, tachycardia, nausea, and vomiting. Stomach 36, the region of influence is abdomen, indicated for distension, diarrhea, and pain. Then spleen 6, in region of influence is the lower abdomen and is indicated for all problems of the urinary system, reproductive system. Then the last is UB40, is at the back. Now, note, LI4 is also called the Great Eliminator. It is very useful in the treatment of constipation, problems related to sweating, passing urine, eliminating bile, and showing emotions. But LI4 is contraindicated in pregnancy, so take note of this, classmates. It is, however, very useful in childbirth. It is best avoided when there is excessive elimination, such as in diarrhea and excessive sweating and others. Yun lang po. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Let's now proceed to the third presentation for today. Let's call on Ma'am Needs You, certified acupuncturist of Silang, Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doctor and everyone. So let's go to the basics pa rin. Needling technique, part 5. Okay. Heat elimination technique or dispersing fire technique. As the name implies, this is the opposite technique to the heat producing technique. We should lift the needle 3 times through the 3 levels of depth and thrust once and repeat this 6 times. So remember po, this serves to eliminate heat from a local area or an area, organ, or region. Again, this is a very effective technique and could be used instead of bleeding to eliminate the heat. Okay, it can be used on a local or a distal point, move point or backshoe point to disperse heat from there. Okay. Bleeding, another one. Another method of heat elimination involves bleeding. A point on a meridian or the backshoe point of an organ. Okay. If the heat is in the superficial area of an organ system, the finger or the point is prepared for bleeding. For instance, in sinusitis or pharyngitis. Lung 11 is bled a few drops. But if the hit was deeper in an internal organ, then the Bakshu point is better than for eliminating the heat from the organ, okay? In the case of bronchitis or pneumonia, point UB13 can be used with bleeding cap, okay? Venous bleeding is also used if there is a suitable vein near a sedation point. Lung 5 venous bleeding is excellent in urticaria. UB40 venous bleeding also is used in the case of a young headache, backache. Sorry. Thank you very much po.
Thank you very much, Ma'am Needs. Let's now go to the 5 elements. Earth element, part 5. Spleen forms connective tissue. The connective tissue attaches our skin onto the muscles and holds and supports our internal organs in place. When the connective tissue loses its tone, skin tends to hang loose from the muscle and stretch marks form. Internal organs may prolapse uterus, kidneys, stomach, and hernias and varicose veins may occur. The connective tissues are nourished by spleen, blood, and yin, and firm by spleen qi, the function. To improve the tone, points and diet for tonifying spleen qi should be used. Local treatment, we do tapping with the plum blossom hammer. Spleen and stomach open to mouth and lips. The mouth is the doorway to the digestive system. It reveals the energy situation in the spleen and stomach. Inflammatory conditions such as stomatitis and gingivitis, ulcers and sores in the mouth, red inflamed lips, these are signs of excessive yang in spleen, stomach. Dryness, cracked or peeling lips indicate yin deficiency in the stomach. According to TCM, spleen dislikes dampness, and in a qi deficiency situation, dampness tends to stagnate. The stomach likes some dampness, hence the liking for creamy, milky, and fatty foods. It needs some damp foods in order to perform its digestive functions well. The spleen, as an organ that absorbs and stores nutrients for the whole body, can have a nutritional deficiency, which is then called blood deficiency. Clinically, this could manifest in underweight and malnutrition and receding pale gums, could be bleeding gums, although this could be a symptom for kidney yin deficiency as well. The center of the tongue, which represents the energy condition in the spleen and stomach, could be deeper than the rest of the tongue. So let's mention another sign of spleen imbalance, teeth marks on the sides of the tongue. It is a symptom of edema on the tongue. Hence, the teeth make impressions on it. To have teeth marks, the patient should have edema on the tongue and he must have teeth. Often, old patients do not show teeth marks, and it is not always because they do not have edema on the tongue. Spleen edema, when mild, manifests in 3 locations: tongue, upper and lower lids, and the hands and feet. When severe, spleen edema manifests on the whole face, lower arms and legs, and the tongue. The difference is in the size of the tongue. When spleen qi is deficient, there is only a problem in the circulation of thick fluid. Tongue is normal size and has teeth marks. When there is a stagnation of fluid and storing of excess nutrients, patient is obese and has a larger tongue with teeth marks. And when a malnourished patient has spleen, blood deficiency, and edema, for example, kwashiorkor, the tongue is small but has teeth marks. Therefore, teeth marks on the tongue do not always indicate excess fluid retention. They also indicate poor circulation of fluid. It is the tongue size, how thick and broad, that is indicative of the quantity of fluid and dampness. So here we have the tower diagrams, like a thick and large tongue with teeth marks, edema in the face, lower arms and legs, overweight. So here you could see a very increased yin which led to a decrease in the yang. So next is normal sized tongue, edema in the lids, hands and feet. And the last one, small tongue, pale, thin, undernourished patient, edema as above. Color of the lips are significant for diagnosing energy status of the spleen. Red inflamed lips, spleen or stomach yang excess. Dry, cracked or peeling lips, stomach yin deficiency. Purple lips, spleen blood stagnation. Pale lips, spleen blood and qi deficiency. Thank you very much for listening. We now go to the topic, the fifth presentation for today, still on 8 principles. Let's call once again Ma'am Teresita Sumile. Hello po.
Yes, Doc. Good afternoon and good afternoon, classmates. Let's now talk about yang and yin. We have yin syndrome and yang syndrome. Signs and symptoms of yin syndrome are pale or sallow face, aversion to cold, nose, dislike of talking, low voice, loose stools, clear and profuse urination. Then the tongue is pale with white coat, pulse is deep, thin, and weak. In yang syndrome, signs and symptoms are red face, fever, hot sensation, thirst, rapid breathing, strong voice, constipation, dark, scanty urine. Tongue is red with yellow coat, pulse is flooding, large, slippery, and rapid. Next is yang and yin associated with 6 principles. We have syndrome of yin, interior, cold and deficiency, and we have also yang, exterior, hot, and excess. Signs and symptoms of interior yin syndrome are weak, lethargic, dislike talking, quiet voice, dizzy, palpitations, poor appetite, or high fever, heavy breathing, chest and abdominal pain and distension, constipation, and delirium. Tongue is pale, swollen, thin with white coat or red body with greasy yellow coat. Then pulse is deep, weak, or deep, full, and rapid. Sa yin cold syndrome, signs and symptoms are aversion to cold, like swarm, pale face, cold limbs, clear urine, and loose stools. And sa yin deficiency syndrome, signs and symptoms are pale face, lassitude, dull pain, palps, weakness, spontaneous sweating, less pressure, shortness of breath, and thin body. Tongue is red with little or little to no coat. And then pulse is thin. Then sa yang naman tayo, yang in yang exterior syndrome. Signs and symptoms are aversion to cold, fever, aching in head and body. Tongue is normal or pale with thin white coat. Pulse is floating. The yang hot syndrome, we have signs and symptoms of fever, thirst like cold drinks, red eyes, flushed face, scanty yellow urine, and constipation. Tongue has red body and dry with yellow coat. The pulse is rapid. And the last is young excess syndrome. We have signs and symptoms of hyperactive forced birthing, pain and distension in abdomen and chest, aggravated by pressure, then dry stool and difficult urination. Tongue is variable body, thick, greasy coating. Pulse is solid or full. Next is yin and yang deficiency and collapse. You have syndrome of yin deficiency, yin collapse, yang deficiency, and yang collapse. Signs and symptoms of yin deficiency, we have red face, 5 palm heat, thirst for cold drinks, afternoon fever, night sweats, dry throat, dark yellow urine, and dry stools. Tongue is red, slight or no cold. Pulse is thin and rapid. Sa yin collapse naman, signs and symptoms are hot, sticky, salty sweat, fever with warm limbs, SOB or shortness of breath, irritable and restless, thirst for cold drinks. Then tongue is red and dry. Pulse is rapid and weak. Next is yang deficiency syndrome. Signs and symptoms are pale face, cold limbs, no thirst, spontaneous sweats, clear profuse urine, and loose stools. Tongue is pale with white coat. Pulse is weak. The last is yang collapse. Signs and symptoms are profuse, cold sweat, cold body and limbs, weak breathing, listlessness, no thirst or preference for warm drinks, and the tongue is pale and moist, pulse is very weak and fading. Yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now go to Zangfu organs. Let's call once again Ma'am Needs You, certified acupuncturist from Silang, Cavite.
Good afternoon, Doc Hector and everyone.
Dali lang po.
Sige po. Okay. Our topic is cold in large intestine. It appears in combination with spleen yang deficiency. Okay. Cardinal symptoms: acute diarrhea with shivering, aversion to cold, dull abdominal pain, rumbling intestines, and odorless stool. Okay. Let's go naman sa heat in large intestine. Okay. It's because large intestine has close relationship with spleen. Disorders of large intestine are often as a consequence of spleen and stomach disorders. Okay. Manifestations of spleen and stomach disorders as a result of stomach fire. It can also affect large intestine and cause heat. Okay. Cardinal symptoms: constipation, strong smelling stools, burning sensation in the anus, and fever. Okay. Let's go to dryness in large intestine. Because large intestine has close relationship with the spleen, disorders of large intestine are often consequence of spleen and stomach disorders. Okay. Manifestation of spleen and stomach disorders: dryness in the lungs can affect large intestine and cause dryness. Okay. Cardinal symptoms: constipation with dry stool, thin body. Okay. Let's go to damp cold in large intestine. It appears in combination with damp cold in the spleen. Okay. Cardinal symptoms: soft, odorless stool, mycosis, aversion to cold, dull abdominal pain, and feeling of heaviness. Kasi may damp, okay? Another one, damp heat in large intestine. It appears in combination with damp heat in the spleen, okay? Cardinal symptoms: strong smelling stools, mucus and blood in the stool, ulcerative colitis, Crohn's disease, mycosis, burning sensation in the anus. Okay. Thank you for your attention, everyone.
Thank you very much, Ma'am Needs, for the presentation. Let us now proceed to meridian theory. We are still on the bladder channel of Food Taiyang, part 6. If the patient has fairly severe tightness in the neck or back that greatly inhibits movement, this is often due to excess cold or dampness in the channel. Redness and boils indicate heat and blood congealing due to a lack of lively bladder chi transformation. Okay, let's try to look at your bladder 40. So if you see visible capillaries behind the knees, at bladder 40, this indicates blood stasis in the bladder channel or DO vessel. Observable signs along the channel do not always mean that the bladder is an important part of the pathodynamic. For instance, if you see small reddish papules or cysts along the bladder channel in the area between T3 and T7, this might indicate heat from constraint in the upper burner, which includes the lungs and heart. Small red papules on the lower back may indicate heat in the large intestine, a sign seen in patients with chronic inflammation or hemorrhoids. There are no special areas for palpating pulses along the bladder channel. Any nodules, tenderness, weakness, or increased muscle tone on the back shoe points indicate some sort of dysfunction in the associated organs. Because of the warm yang nature of the Taiyang channel, it is more likely to involve yang or qi deficiency. Because the area is also in close proximity to the yang nature DO vessel and its collateral vessel along the important Huato Jiaqi points, a wide variety of palpable changes can be found in the area. It is most helpful to keep the organs associated with each of the back shoe points in mind when you find changes along the bladder channel on the back. Tenderness at bladder 64, the source point of the bladder, indicates qi deficiency of the channel. This is seen in chronic back pain. So if a patient complains of chronic back, if you feel some tenderness at bladder 64, the patient might have chronic back pain. Also, in cases of chronic back pain where blood stasis is involved, there may be small, relatively hard nodules in bladder 64. The chi cleft point of the channel, which is bladder 63, is reactive and very tender in cases of excess. Palpable change at bladder 63 indicates stagnation in the channel. Common symptoms, acute back pain. So if we feel some, or if we palpate some tenderness on bladder 63, it could be acute back pain, together with Taiyang channel headaches, or there might be urinary or kidney stones. Weakness or tenderness at bladder 60 indicates cold dampness in the sinew channels of the bladder. Because bladder 60 is also the influential point of the yang chow vessel, tenderness may indicate involvement of the sinew channels of multiple channels. So here we see the points that we have discussed. Sinew problems may involve increased tightness or thickening of the fascia in the area between bladder 57 and bladder 58. This may include acute low back or neck spasms, and or tightness. For acute back sprain, bladder 40, the command point of the back, will show nodules, distended vessels, or tightening of the surrounding tendons. So tingnan niyo yung bladder 40 nyo, baka may mga ma-feel kayo na nodules, distended vessels, or tightening. So that patient must be experiencing acute back sprain. In patients with chronic back problems, the area will look puffy and will feel quite soft when cold accumulation in the bladder channel is part of the pathodynamic. So nodules may also be found sa bladder 40 in bladder type, which is occipital headaches. No? Because this is a uniting point on the channel, we will feel palpable changes or small visible blood collaterals in the case of counterflow in the bladder channel. Counterflow in the bladder channel is seen in cases of summer heat that include nausea, vomiting, and headaches. In such cases, a few drops of blood should be directly removed from any visible blood collaterals. There may also be visible blood collaterals that should be bled in cases of hemorrhoids. Okay, so here you see the points. Bladder 57, bladder 58. When there is, and bladder 40, right? When there is a tumor or enlargement in one of the internal organs, the area between bladder 36 and bladder 37 may have deep nodules or tenderness when pressing deeply. So press nyo na yung bladder 36 nyo, the area between bladder 36 and bladder 37. Kung may find out if you have deep nodules there or may tenderness when you press deeply. So I hope you could do it now. And good luck. Okay, so to summarize, if we've, tenderness, okay, for the back shoe, back associated points, you observe tenderness, nodules, softness, or weakness, no? So if there is tenderness, there could be deficiency or inflammation affecting the organ in associated area. So kung may mga nodules, this could be a chronic organ condition, may involve physical organ changes. If there is softness or weakness, there could be yang deficiency affecting the associated organ. Now, the area along bladder 36 and bladder 37, if you want to know if you will have some inflammation or tumors in the organ, you would feel some nodules or some tenderness there. Then if you see capillaries, okay, in bladder, there could be hemorrhoids or stasis in the Taiyang pathway on the back or summer heat, no? Along bladder 40. Nodules, tightness or thickness, nodules, you will feel you will have occipital headaches, counterflow affecting the bladder channel. So if you have tightness or thickness of the bladder 40, you can have tightness of tendons throughout the back, inflammation in the channel. For bladder 57, bladder 58, if there is tightness or thickness, back neck spasms due to Taiyang stasis. Okay, then if you have tenderness at bladder 60, cold accumulation in bladder sinews, it often affects the occipital area. So if you have occipital headache, no? Bladder 63, tenderness at bladder 64 indicates Qi deficiency in the channel. And if you have pain at bladder 63, this is seen in acute Taiyang conditions, often in the back. Then shallow nodules, inflammation, or Qi stagnation affecting the channel. Hard nodules indicating blood stasis. Thank you very much for your attention. We now proceed to the last topic for today. Chest painful obstruction. Okay, identification of patterns and treatment. So let's start with the full pattern, stagnation of Qi in the chest. So distending pain in the chest that moves from place to place and comes and goes. Hypochondrial distension. Tongue, not significant. Pulse is wiry. This is due to stagnation of qi of the liver and heart. The feeling of distension, the moving of pain from place to place, and the fact that it comes and goes are all typical of qi stagnation. So treatment principle, move the qi, relax the chest, soothe the liver and heart, stop the pain. Points, REN 17, pericardium 6, triple burner 6, GB 34, liver 3, bladder 17, bladder 15, bladder 18, bladder 14. We do reducing or even method. REN 17 moves the qi in the chest. Okay, we insert the needle horizontally downwards, but it can be slanted towards the direction of the area of the pain. Pericardium 6 moves the qi in the chest, relaxes and opens the chest, calms the mind, and settles the ethereal soul. Triple burner 6 and GB 34 move the qi in the hypochondrial region. Liver 3 moves the liver qi, relaxes the sinews, calms the mind, settles the ethereal soul. Bladder 17 relaxes the diaphragm and the chest. Bladder 15 and bladder 18, bakshu points of the heart and liver respectively, they move the heart and liver qi. Bladder 14, bakshu point of the pericardium, moves the qi in the chest. Now let's talk about heart blood stasis. There will be pricking pain in the chest, fixed and worse at night, and palpitations. The tongue is, of course, purple, especially in the chest area, or on the sides in correspondence with the chest area. Pulse, deep and choppy. Treatment principle, invigorate blood, eliminate stasis, invigorate the connecting Luo channels, stop the pain. So here this is the chest area on the tongue. Okay, could be behind the tip or it could be on the sides. Points, bladder 13, bladder 14, REN 17, bladder 15, REN 14, pericardium 4, pericardium 6, stomach 40, spleen 10, bladder 17, do 12, do 11, do 10, SI 11. All needled with reducing or even method depending on severity of pain. The points on the governing vessel, do 12, 11, 10, can be alternated with those on the directing vessel or the REN channel, REN 17, 14. Bladder 13 stimulates the descending of qi and invigorates blood by moving qi. Bladder 14, REN 17, bladder 15, and REN 14 are bakshu and front collecting points or front mu of pericardium and heart respectively. In acute cases, they are used with reducing method. These are the main points. REN 17, remember, to needle horizontally downwards. So if the chest pain extends towards the left side, REN 17 can be needled horizontally towards the heart. So you might have relatives who can, of course, you have to call the ambulance, call the hospital, but while waiting, you might be able to do this modality. Pericardium 4 is the accumulation point, so it stops pain and is indicated specifically in acute syndromes. Pericardium 6 is the connecting point and the opening point of the yin linking vessel. It opens the chest, moves qi and blood, removes obstructions. Should be needled, reducing method. Stomach 40 opens the chest in combination with pericardium 6, and it subdues rebellious qi. Spleen 10 invigorates blood. Bladder 17 invigorates blood, relaxes the diaphragm. Do 12, do 11, and do 10 move the qi and blood in the chest. SI 11 invigorates blood in the chest, and this is chosen when the chest pain extends to the scapula. Thank you very much for your attention, and thank you for joining our group, and we hope to see you in our next presentation. Thank you.